On the heels of recognizing World Mental Health Day this week, we want to shine a light on the crisis within the black community. Suicide rates among black youth are skyrocketing. According to the Journal of Community Health, the suicide rate among adolescent African-American boys ages 13 to 19 rose by 60% between 2001 and 2017. And for black adolescent girls from ages 13 to 19, the numbers are even more dire, with rates increasing by 182% over the same time period. For more on this health crisis, I'm joined now by New Jersey Congresswoman and House Homeland Security Committee member Bonnie Watson Coleman. Congresswoman, thank you for being here.
Thank you for raising this issue today.
It's a critical issue that you've raised. Why do you think we're seeing this increase? What is the thing that is accelerating this?
Well, I think that in general, we're living in some really tough times, and we're living in some really mean times, and the wealth gap is just getting huge, and poverty is just more intransient. And I think our children are being treated badly. I think that they're experiencing discrimination in a way that's more overt than it's been in quite a while. I think that our children are being bullied. I think if you're black and LGBTQ, you've got a double whammy going at you. You know, some of the startling things, you mentioned those two age categories, but we've got children 5 to 12 years old committing suicide.
Wow.
What could they possibly be thinking?
Wow. And when we look at males, 60% up from 2001 to 2017, and it is not, other than you, a national crisis. If this was not in the black community, imagine if these were in the white community, it would be on everybody's table, door.
It would be treated like
platform.
The opioid crisis is being treated now versus the war on drugs.
Now, we should also note that black male children ages 5 to 12 have higher suicide rates than any other racial or ethnic group. That's according to New York University's McSilver Institute on Poverty Policy and Research. What do we need to start doing to really grab this and begin to turn it around?
So I started seeing this on Facebook, and I said to my staff, this is awful. There's too much happening here. We need to get a handle on this, and we need to at least raise the issue. Talked with Karen Bass, who was the chair of the CBC,
right, and
we put together the emergency task force to look into this issue. So we've got a whole working group with Dr. Michael Lindsay and, you know, educators, all kinds of academics, doctors, all kinds of people, social justice workers, and we've been holding a series of hearings. And we're going to have a hearing coming up next week with young people, young boys and young girls. We're trying to get a handle on a couple of things. Number one is, what do we need to be looking for? Because there are parents who are telling us there were no signs. And they went into their child's bedroom and the child was hanging.
No signs. Wow.
No signs. We're trying to talk about generational trauma, generational discrimination, a sense of low value, no access to health care, very low access to health care. We look at even the role of the churches in this. You know, we've grown up, you got Jesus.
Right.
You don't need anything else,
right,
you know, just buck it up. Talk in tongue, as one of my young panelists has said one time, and don't take your medication because it makes it worse. We have a stigma in the black community when it comes to dealing with mental health. And so it
is a mental health issue.
It is a mental health issue. You know, and I tell people, like, I had a problem with my knee. I need a new one. I went to an orthopedist. If you have a mental health issue, you got a mental health issue. It's in the brain. You need to have someone talking to you and helping you to find coping skills and just helping you to realize how you can live a valuable life. And we just don't have enough of that. And then, on top of everything else, we don't have enough culturally competent people working in that space. So I'm on the Appropriations Committee as well as Homeland Security, and I look at this very much from what I'm going to fight for when we start talking about dispersing resources. We need more research. We need more understanding of what's going on. We need to have resources out there for schools to have people who can see signs early, who are trained in the, you have a health kit, you know, what is it, the health kit that you have. Well, you got a mental health
Right.
kit as well, which teaches you to look for certain things. We need to talk to our parents. So it's a very complex issue. It's a very important issue. And I'm grateful for Taraji P. Henson, who came in and shared with us her struggles.
Yeah, she was very effective. Well, I couldn't have thought of a better advocate to bring this, and we'll follow it through because I know you're very consistent work in many areas. New Jersey Congresswoman Bonnie Watson Coleman, thank you for being with me tonight.
Thank you for having me and for raising this issue.
Up next, my final...